Welcome to the Protecting Your Nest podcast. As I pause and reflect on the previous year, all the challenges we face and all the souls we've lost, I've realized that before I learned the principles that I teach with my Protecting Your Nest podcast, that there are so many people out there who just need help. And if only they understood that lifestyle changes was the key. So why not in 2022, why not make that the year that we make a commitment to understand the healing message that reversing chronic medical conditions can be done by simply adopting those lifestyle changes. So let's continue our journey in 2022 with another story of healing that I want to introduce you to. And that person I'm going to introduce you to is Dr. Sybil Cooper. Dr. Cooper earned her PhD in immunology and is now a functional nutritional counselor with certifications from Andrea Nakayama, if I'm saying that right, full body
Yes.
systems. Is that close enough, Doc?
Yes, that's it.
All right. As well as being certified in levels 1 and 2 of the Primal Health Coach Certification Program, which is focused on helping people like our doctor coach others to age gracefully. I wanted her to be my first guest. You're my first guest of the new year because so many people are suffering from autoimmune conditions, and they really need to hear from someone who has taken a different path, who has found another way. And I want her to share her story of healing, how she used ketogenic diet, intermittent fasting, and so much more to heal. So with that, Doc, I welcome you to Protecting Your Nest.
Thank you so much. I'm honored to be your first guest of 2022.
That's right. Well, the pressure's on, but don't worry. We got this. And it's really a pleasure. I remember the first time I saw you pop up as a follower. I think I saw you interacting with A-Day Fox with the Black Carnivore on her platform. And it was just nice to hear your story. I heard a little bit on her podcast as well. So just so happy to have you. And we just want to make sure people who may want to hear it from your perspective are inspired, because we have to have all the voices at the table. And I think that's going to be really important. So, but I want to start our conversation by touching base about your roots in New Orleans, or should I say New Orleans. And actually one of my previous guests, Benny Tortorich, was also someone with roots in New Orleans, and I really enjoyed being down there in the South at Xavier. I would not be a doctor today. I was deciding between University of Illinois and Morehouse and Xavier, and Xavier was in some ways a factory for getting communities of color, African Americans, into medical school. And if anybody doesn't know that, just look it up. It's a factory. My wife's a pharmacist. It's also a factory for pharmacists, and it's just a wonderful place. So I love New Orleans. I love the culture. And of course, we all love the food. So since you have roots in New Orleans, let's start our conversation by you sharing any memory you'd like to share about growing up in New Orleans.
Well, I actually grew up on the North Shore, and so, quite different from being in the city of New Orleans. Very much, a country girl. And, my fondest memories really are just the independence of childhood, just getting on your bike and riding across town, going to the local swimming hole. So very different from what, kids have.
Did you
today.
say swimming hole? You say swimming hole?
Swimming holes, yeah.
Oh,
That's
Lord.
what we call it, swimming holes. With the water moccasins in the bayou with the snapping turtles.
That's a bit much. So that's a memory
Yes.
I will not forget. And just so people know, as we kind of talk about culture, of the cultures that of the demographic that has the most issues with swimming is Black boys. African American boys don't know how to swim, and so they have the highest incidence of drowning. So we need those. We need to be exposed to those so that we can swim. So that's very interesting. I love it.
Definitely.
You also I don't know. Did you ever see Princess and a Frog, the cartoon with
No,
Disney? I
I
have to.
didn't.
I'm
I
gonna
read about it.
yes, and is you're gonna love it with your roots. And I bring it up because clearly it touched me because I think the princess in there, Tatiana, was the first African American
Hmm.
princess for Disney, right?
Yes.
So that
Hmm.
was number one. But the part that really, I think that they had a character. He was a lightning bug, I think, and his name was Raymond, or they called him Ray, but they actually, in New Orleans terms, they'll say Raymond.
Hmm.
Raymond, and he was helping the main character, the princess, and Princess Naveen find this voodoo priestess, and it was just wonderful because the culture resonated from that lightning bug. I mean, it was like the,
Hmm.
the way he talked. It was all New Orleans,
Hmm.
and when I was in school in New Orleans at Xavier. Um, it was like you couldn't tell who the smartest students were because they would sound in your mind from Chicago like they weren't being talking proper, right? I'm like, I can't
Yes.
understand what you're saying, but you got straight A's.
Uh,
So it was like, so anyway, I think that's a great movie. I definitely want you to put it on your to-do
hmm.
list. And for those who are listening or watching, that's a wonderful cartoon with a whole lot of New Orleans culture. So thanks for sharing a little bit of your, your
Hmm.
background. And I want to now dive into a few other thoughts. And I know you became this PhD in immunology, and then you kind of put your career on hold to raise your three beautiful kids. So talk a little bit about why you decided to become an immunology, maybe even tell people what that is, and then share, because people may not know, right?
Hmm.
And then talk a little bit about why you decided to be a stay-at-home mom.
Okay. Well, immunology is the study of how the immune system works. So, how we fight pathogens such as viruses, bacteria, how we recognize our cells from someone else's cells, say in a transplant or a blood transfusion. And I was raised by a single mom who, firmly believed that education was the way, to a self-sufficient life. And she bought me, when I was in elementary school, a set of the Encyclopedia Britannicas.
I
And with
remember.
that, yeah, with that came a monthly subscription for their science volumes. And I still remember to this day the chapter and the diagram of what happens when you get a splinter, like
Mm,
all the immune cells that come to the site and generate that inflammation to fight the bacteria and get rid of the dirt and the toxins that come with that splinter. And I was intrigued from that point on. I knew that early that that's what I wanted to study because I was so fascinated about how the body works.
cool.
And so I did my biological science degree at University of New Orleans. And then from there, I went to University of Texas, MD Anderson Cancer Center in Houston. And then from there, I went to La Jolla Institute for my postdoc in San Diego. And
Cool.
so most people, when they think about an immunologist, they think of the person, the clinical immunologist that deals a lot with, chromosomal
Hmm.
translocations that give you
Hmm.
T cell deficiencies and that sort of thing. So I was a basic science, research
Hmm.
immunology. How do T cells work? My lab as a graduate student was fundamentally involved in elucidating the TNF receptor
Hmm.
pathway. I, in fact, cloned the human version of the TNF receptor type
Nice.
2 pathway. It was
Nice.
the fight to publish first,
Right.
that sequence. And so, I love discovering new things that like no one knew before. What do these proteins do? How are they involved? What might be, the clinical implications for those proteins? And I still remember when I went to an international meeting and they posted the very first data of this young gal who was essentially bedridden because her Crohn's disease was so bad. It had
Mhm.
basically eaten through her skin of her buttocks. And
Mm.
she had been a horse trainer. And, obviously you can't do that. And so she was treated with one of the first TNF antagonists, and they showed the results
Mm.
of her riding off into the sunset on her horse. And to know that you had, just a small role in, determining what those pathways were that led to, helping someone was just, immensely joyful
Yeah, I
for
love
me.
it. And that's
Hmm.
and I feel the passion in your voice. By the way, when at University of Western States where I'm studying nutrition and functional medicine, don't quiz me, but I just finished my immunology class.
Oh, yes.
Yeah, I was like,
Well,
so
I've been trying to catch up just on the past 10 years, and
I can imagine.
it's just so, you
It's just
know,
constantly changing. Yeah, because a lot of the studies that we reviewed were fairly recent, and with
hmm
the COVID situation, there's a lot of talk around your
hmm
area of expertise, and then you took a break, you took care of the kids, so what led to that
hmm
decision?
it wasn't really a conscious decision, actually. And, you always think about that path not taken, like, oh, yeah, because I miss it. It's still, my heart, and I love to read research papers.
Yeah.
But um, I was diagnosed with incompetent cervix, and I had to have a cerclage to have my
Yes.
kids. So I
Yes.
was on, very strict bed rest with my son, my first son, Nathan, and he was born preterm,
Okay.
at
Yeah.
30, 35 weeks, I think, and, very underweight. And so, of course, 6 weeks, 8 weeks, 3 months, I
Yeah.
wasn't ready, you know, in a city where I didn't know anyone, I didn't have any family that I would
Mm.
trust to take care of, this new human being. And then my husband got a job in New York, and we moved here. So then it was okay, well, take a year to get settled, find a
Yeah.
house.
Yeah.
And I'm an only child, but my husband is an identical twin, and he has an older brother. And if he, of course, wanted siblings, for his kids. So it's like, well, what's the point of trying to find a job if I'm going to be on bed rest in 6 months for another
Right.
6 months,
That's right.
Um, so then after I had my second one, and I was, like writing the resume, looking at universities, in the city, I was 39 years old, and I got pregnant with my third child. So
Wow.
yeah, so after that, my oldest was unfortunately bit by a tick that
Oh,
had
Lord.
multiple co-infections, and
Mm.
so that led me down the nutrition path of trying to heal his body
Mhm.
from years of
Mhm.
antibiotics and
That's
antimicrobials
right.
and cycling, and we had to do home IV antibiotics, which I had to do. Right, think about injecting your kid through a port, every day, trying, sterile. Thank God I knew sterile technique. It all came
Right.
back to me. Um, and
Wow.
so, dealing with that, my husband was also diagnosed just before that, months before that, with thyroid cancer. So he had to
Mhm.
go through treatment from that. And so a lot of that
It's a lot.
stress,
Yeah.
that generated like chronic insomnia and anxiety attacks while I was sleeping, I think is what led me down my autoimmune path, ultimately. Just,
And
years of worrying
yeah,
about your kid.
and that's really important to emphasize. First of all, shout out to all the moms who sacrifice to make our babies because I delivered babies in my previous. I'm a family doctor, so I
Mhm.
did a lot of obstetrics. I did a fellowship. I was actually doing C-sections too, was DNCs as a family doctor trained to go into a rural community. Never really did that, but that's my training. So I
Mhm.
had a lot of high risk pregnancies in front of me that I co-managed with the specialists, but I saw what the moms went through, and being having to be in the hospital for weeks sometimes,
Mhm.
tilted so that the baby
Yes.
the pressure won't be in the pelvic area.
Mhm.
And so I just want to just apply the sacrifice, and then it continues, right? it continues
Yes.
afterwards. So it never ends. And
They're in college and it still hasn't ended.
I
The
mean,
older two.
trust
Yeah.
me. And I got a son that's in shout out to Brandon in Costa Rica,
Mhm.
traveling during the pandemic. That's, you know,
Oh,
we're all
wow.
paranoid right now, but the kids are going to do
Hmm.
their thing. We just make it as safe as possible. So
Hmm.
just thank you for sharing that. Thank you for your sacrifices. And obviously all of those things led to stressors. And that's why I have a nest, right? Because the sleep and the stress are so critical. And if you're not getting
Hmm.
enough sleep, or if you're stressed, you're going to still be sick. So I can sit here
Hmm.
all day and talk about carb restriction or carnivore or keto, and for those who like,
Hmm.
plant-based diets, so we can talk about whole foods. But none of that will matter if you are living in a ball of stress. So
Exactly.
people need to understand it's not just about, trying to reach some goal. It's about if I keep my stress down and do these other things, I may be healthier, even being in a healthy relationship, as you mentioned,
Hmm.
your husband.
Hmm.
So let's
Hmm.
let's go back a little bit and talk a little bit more in detail about those. You mentioned, you had some struggles, and let's let the audience understand those autoimmune conditions that you
Hmm.
suffered from, and that journey of how you were able to kind of figure out how to heal from that.
Okay. Let's see. So I had my daughter at 40, and probably around maybe when she was 3 or 4, you just start feeling tired. And your doctors tell you that, you're a mom, you got 3 kids, you're getting
Hmm.
old.
I'm guilty of that.
And
I used to do
yeah.
that.
And and so it got to the point where and I was, training a lot. I was doing like P90X and, running races. And I just started having problems with my eyes. And I went to, my eye doctor, and, who's a friend of mine. And he said, he examined my eyes and he said, wow, you have a lot of corneal abrasions. And he said, do you have autoimmune disease in your family? And I said,
Hmm.
well, actually, my grandmother died of scleroderma, after a very bad viral infection.
Hmm.
And he's like, I'm thinking that you might have an autoimmune disease called Sjogren's syndrome. And, I'd like you to go see a doctor. So it was actually my eye doctor that diagnosed me. All my other doctors kind of dismissed it because I was really fit and I had a lot of muscle, and so it's easier for them to say, oh, but you
Hmm.
look great. And you're like, but I don't feel great. That's
Right.
the
Right.
difference. So I went to a rheumatologist, and we went through my symptoms, and he did feel that I had Sjogren's syndrome. So I started reading about autoimmune disease and what my grandmother had, and somehow I was listening to I think a YouTube video of a conference, and it was Rob Wolf talking. I don't know if it was Mark Sisson, talking to a bunch of guys, and he mentioned autoimmunity. His mother had Sjogren's, started talking about paleo. And I was like, wait a minute, paleo, that's that, weird diet my friend told me she's been on, where, you have to eat meat. And
That's right.
it's like, at that time, it's like, my husband and I are getting a steak this big and cutting it in half.
That's right.
And so, twice a week. Um, And so I started researching that, and I found, I think, Dr. Sarah Ballantyne, the
Hmm.
Autoimmune Paleo Protocol, and Angie Alt, and I just started reading all of those stories of healing.
Hmm.
And my rheumatologist actually told me, um, if you have autoimmune disease, you really shouldn't be eating gluten,
Hmm.
And I thought,
Hmm.
wow,
That's
that's what I read. And I thought that it was, really fringe idea. But when you have your doctor telling, that that's, inflammatory, and here's some books you can read on the topic. And so I started, eliminating those foods from my diet, and I started feeling better.
yeah.
It was, really remarkable. And so my journey was pretty gradual in that I started, eliminating the gluten, not quite getting there, and then realizing a friend of mine who actually had celiac disease told me that a lot of people who react to gluten often react to tapioca starch. And where most people go wrong is when they go gluten-free is they start heading down the gluten-free aisle, you
Mm-hmm.
know,
That's
to
right.
replace all those breads and pastas and, cakes and cookies you want to eat. And they're all made with tapioca.
Right.
Yeah. So once I realized that I had to really remove processed foods from my
Right.
diet
That's
is
right.
when the healing really started, and
Yeah.
I started feeling better. My eyes weren't as dry. I mean, I would have to pull over driving because my eyes would start burning and I couldn't see. So,
Wow.
dangerous conditions to be driving. Um, but then, continued stress, I think of, managing my son's illness and trying to get the help that he needed. And at that point, I was homeschooling,
Mhm. Yes.
two of my kids, and I had the toddler that I'm managing. Um, I started just developing, other symptoms. And I went to the doctor and he said, well, I think you might have MS. I need you to see a
Mm.
neurologist because, I had been used to doing pull ups. I had already done 3 Spartan races, finishing in the top 10 of my age group,
Mm.
women, 40, doing 30, 40, 50 push ups. And I went into a push up and I couldn't get up. I couldn't
Wow.
get off the floor. And so then I was diagnosed with myasthenia gravis,
Okay.
instead of MS. And so then it was, doing more reading and just realizing, what, my sleep is crap. My stress is, I'm not managing that very well, that I have to focus not just on the nutrition,
Mm-hmm.
but all of these other lifestyle factors. And then once I started dialing those in, it's like having a 4-legged table. You can, cut down one leg and your table kind of goes like this, and you cut down another leg and the table starts to wobble.
Wow.
And so I started, really focusing on my sleep,
Yeah.
just having to honor, that bedtime. And thankfully, my kids were getting older. And so, I didn't have them waking me up during the night. And, realizing, I can't wake up at 5:36 a.m. just to work out
Right.
if my body's in a flare. It's more
That's right.
important for me to rest than it is for me to work out. And a lot of people in the autoimmune community are very type A people. We're very driven, you know.
That's right.
So, um, and so that was the next part of my journey, was incorporating those lifestyle factors of just sleep, rest, just taking walks, getting outside.
That's right. That's right.
And um, from there, so now I'm my late 40s, and all of these issues were compounded by adenomyosis, which is similar
Mm-hmm.
to endometriosis, but on the
Mm-hmm.
inside. So I had
Mm.
chronic anemia, which is one of those stresses on the immune system, right? Um, and so finally, my doctor said, "You really, don't have a choice. You need to have hysterectomy."
Mm. Mm.
So I had a partial hysterectomy in probably 8 or 9 months, maybe 8, yeah, 8 or 9 months later. Like my eye started swelling up, one eye, then the other eye, and rotating. And then I started having patches of my skin that were just burning on fire and inflamed. And so then I was diagnosed with mixed connective tissue disease.
Mm.
And I actually had 2 doctors tell me that, you know what, I've had patients with, similar, because the eye swelling, I even went to like the top doctors in New York City, and no one had an explanation. Because I had episcleritis and scleritis and orbital swelling and periorbital swelling that happened every 4 weeks like clockwork. And I'm like, okay, there's only one thing that happened, well, 2 things: phases of the moon and a women's monthly cycle that
Right.
happens every 4 weeks.
Right.
And both of them said that it was a progesterone deficiency in their 2 patients that they had. And So at that point, because it seemed more life threatening, I went on methotrexate just to kind of bring my immune system
Mm-hmm.
down just a little bit. And so that worked very well until March of last year when my liver enzymes went high. And so my doctor started weaning me off the methotrexate, and the mixed connective tissue disease started to return.
Mm.
And at that point, I started working with a functional practitioner team, Wise and Well, and I had some blood work done. And yeah, all of my sex hormones were
Mm-hmm.
very low. Even though I had kept my ovaries, you do get damage to your ovaries when you do have a partial hysterectomy. And so within 2 weeks of starting the progesterone, all of my symptoms went away. It
Mm.
was just like
Just like
the
that.
sky opened up. And, women often will have remission of an autoimmune disease during pregnancy and then a severe exacerbation once they deliver,
Yeah.
as those hormones, crash. And so, within 6 weeks, I was back to working out. I was starting to lift weights again and just, and so I think that is also very underappreciated. And we know that autoimmune disease disproportionately affects women,
Mm-hmm. No doubt.
compared to men. And so, I think there's still a lot more work to do in that area on how our sex hormones interface with the immune system.
Yeah, you have you're kind of blowing my mind because if there's a God, I'm not sure what kind of joke he was playing on you to make you an immunologist.
And everyone says that.
What kind of joke? So if there's a heaven and we end up there, hopefully, we have questions to ask, and then maybe in some ways it's perfect in terms of you having the ability to look at it from your training perspective as well,
Mm-hmm.
and knowing that there may be an answer. One thing I want to say out loud is for those who are listening who suffer from autoimmune diseases, never, ever, 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 ever let anybody tell you that what you're experiencing is normal.
Mm-hmm.
Absolutely, if you're trying to take care of those babies and you're tired, that's real. Postpartum depression
Mm-hmm.
is real. But if things
Yes.
are beyond what we consider reasonable for those diagnoses,
Mm-hmm.
we need to peel that onion. And
Mm-hmm.
thankfully, conventionally trained docs like myself have partners, and I'm also getting training in functional medicine as well. And sometimes you got to go into a different arena because they're going to look at it with fresh eyes and from a different perspective. So I think
Mm-hmm.
so people make sure that when you're stuck and conventional medicine is not treating us the way we want it to, that's the way to go. Hopefully we'll have a metabolic health doctor certification or category. We have certifications
Mm-hmm.
with the Society of Metabolic Health Practitioners, but hopefully
Mm-hmm.
we'll have a board certifying category because I think metabolic clinicians understand inflammation, insulin
Mm-hmm.
resistance, and even if you said adenomyosis, for those who don't know, that's just when the uterine tissue grows into the muscle,
Mm-hmm.
where it should be growing into the muscular layer of
Mm-hmm.
the uterus, and all that inflammation is probably why it occurred. So
Mm-hmm.
and I just can't believe you had three. And then but it does remind me of my nest and rope, and you gotta again think about all the things, and until you started to doing all the things necessary to heal, you
Mm-hmm.
really didn't heal. So with the
Mm-hmm.
so now just briefly, I know you're, carb restricting, but I
Mm-hmm.
also know you follow the Black Carnivore. So, how far have you taken your
Mm-hmm.
carnivore journey? How far are you going with the diet change?
Okay, so my family, my father's side, I think everyone has died in their 60s or 70s, with the exception of one great aunt,
Mm,
from diabetes, hypertension, cardiovascular disease. My beloved great aunt actually had the same leg amputated twice because, the infection and not being able to heal. They do the below the knee to try and give you more
Right.
mobility, and then it was above the knee. And just seeing such a vibrant, smart, witty,
That's right.
woman, lose that independence. And then every time she'd have a stroke, just a little bit more of her just, being taken, so young. But that wasn't going to be me because, I lifted weights for an hour and a half every day. I was full of muscle. I was strong. And then I'm in my 40s and my A1C is 5.7, 5.9, 6, 6.1, 6.3. And the entire time it's going up, the doctors are like, oh, no, you're fine. And I'm like, I know. But then the next year, if this path continues, it's going to be 6.5 and you're going to want to put me on medication, right? And so I started, researching low carb to figure out, why when I was doing everything right, my body was still on this path. And so that was my impetus for going, low carb. And it worked beautifully. And for the first time in, probably 15 years, I had stable moods. I wasn't, like just flying off the handle. If something falls on the ground and breaks,
Right.
it wasn't. And, my husband would joke, like, do you even have a liver? Because I had to eat every 2 hours or I would just get so hangry. And this, the whole time, my fasting blood sugar is like, 99, 100. So the doctors aren't worried. But looking back, clearly I had metabolic issues for, all of my 40s, which very likely was another piece to the puzzle of my autoimmune disease, as well as the fibroids. We had that fantastic webinar about insulin resistance and fibroids in women. And it's, particularly problematic for African American women.
Yes, yes.
And, I've had several doctors say, I firmly believe that most African Americans are carb intolerant. And it was certainly true, for my case, and for my father's side of the family, I think certainly. And so I went low carb, and then I was still having just some, issues with the autoimmunity. And I don't know if I actually shared this in public before, but I started getting lost in my town that I had lived in,
Really?
for like 20 years, like in my late 40s. It starts with, where was I going? Like you're driving, it's like, wait a minute, where was I going? Target, post office, or forgetting where your car was. And then, it was a very scary episode where I just didn't recognize where I was going, didn't know how to get home. I just kept driving. And then it was kind of like coming out of a fog where things started to look familiar. And I'm thinking, am I having a stroke? And I was like, just keep driving, just keep driving. And then finally I figured out, how to get home.
Oh, God.
So I started researching, and, my father's aunt had the diabetes and the heart disease, but also was in a home with dementia, full dementia in her 60s, right? So at this point, I'm almost 50 looking at. So I started learning about brain health and dementia and Alzheimer's disease and the ketogenic diet. And that was sort of the next layer, of that onion where my brain fog went away. And sometimes it's easy to attribute, oh, you have autoimmune disease, that's what's, causing this. But I think for me, it was the inflammation and the insulin resistance, my brain just not utilizing carbs, efficiently, compounded by all the years of just not sleeping and having that time, that deep sleep. When I first got my Oura ring, my deep sleep would be 15, 20 minutes a night. And you look at people like Dr. Peter Attia or Dom D'Agostino who are sporting, 3-hour deep sleeps. You're like, who are these people? And so then I just assumed that was normal for me. And when I started just getting my ketones up, And for me, I didn't even have to get my carbs that low,
Hmm.
because of my training.
Right.
Um, you know, 50 grams total carbs, 75, 75 total. I was, definitely in ketosis. And
Yep. Yep.
I think that is what, just really allowed my brain to heal, in addition to focusing on my sleep. And then all of a sudden, I was getting 2 hours of deep sleep a night.
Mm. Isn't that crazy?
Yeah. Yep.
So
1.5 to 2 hours, a night, I think, just by fueling my brain,
yeah.
properly with foods that nourished my body. So just a return to animal fats,
Hmm.
no vegetable oils, just real butter, olive oil, the fruit oils,
Hmm.
olive oil, avocado oil. Started, making tallow and
Hmm.
buying tallow and
That's right.
coconut oil. And, that was kind of the final, healing piece to the puzzle for my
Wow.
brain and my immune system.
Yeah.
And I'm still in, remission without any medications, from my autoimmune disease. But it'll take 4 days of just not sleeping, and the flare will start.
Yeah. I know that
Yeah.
because I've shared that I have, I had the irritable bowel, and it's always there, but it's not there, right? So I
Mm-hmm.
already know. So my incentive to cheat, and I hate to use that word, but I use it anyway. My incentive to cheat is not it's not high, because I know that I could fall back into where I was, but it's also
Mm-hmm.
nice to not have to worry about that. So
Mm-hmm.
one of the messages I'm hearing from you is that, you have this borderline A1C, and anybody who is a metabolic health clinician knows that that means that your pancreas has been struggling for years,
Mm-hmm.
maybe five,
Mm-hmm.
10 years. So,
Yes.
so you can really predict with really a fair amount of accuracy. If you just do a fat, just do. I mean, there's tests. There's all kinds of a HOMA IR, fasting insulin level. Just do get your doctor, if you're listening, to do a fasting insulin level, and it should be 15, 20 or higher. It should be in the single digits, really. And if
Mm-hmm.
it's like, over 10 for sure, Houston, we may have a problem. I
Mm-hmm.
do remember listening to, I think, one of the, lectures that were given with the Society of Metabolic Health Practitioners, and a previous guest was Dr. Salcido. And she's a gynae doctor who talked about all the gynecological conditions
Mm-hmm.
that are related to metabolic health, like fibroids and uterine cancer. So I think about you getting lost, and you're so young to be getting lost, right? And
Yes.
it's like insanity. And and
Mm-hmm.
and so maybe all forms of dementia are not metabolic. Some people are labeling it Alzheimer's dementia as type 3, but clearly some forms are,
Mm-hmm.
and even when
Yes.
you're not sleeping, you can't clean the brain of all that
Mm-hmm. Mm-hmm.
inflammatory debris. So it's just important that as people hear your message, that they understand, as I've echoed over and over again, you got to think about all of these things, and
Mm-hmm.
one of those things in the nest is exercise. And I saw you with your muscles, with the bow and arrow. I said, "Ooh, if Whitney Houston can have a bodyguard, maybe Dr. Hampton can." I got
Yes.
me a bodyguard. I'm a city boy. I don't know nothing about bows and arrows. So I want you to talk a little bit about what you're doing for exercise, but
Mm-hmm.
even more interesting, what's up with this bow and arrow thing? Where'd that come from?
Well, I grew up as a kid, and we made our own bows and arrows.
Cool.
And with my kids, they were like, can we
Right.
buy one? And so I bought, I bought all of us, bows and arrows. And I've always enjoyed target games. And actually, when I was in high school, people love this story. We actually learned skeet shooting as a part of PE. So you
Mm,
could bring your rifle to school, to the principal's office, unload the ammo, which they cannot happen today, right? And we'd go out to
mm,
the lake and learn skeet shooting. And so I still learn. I still love games like that, because I think just maintaining that eye-hand coordination and controlling your breath and just focus is, important. And so it's just good to have something fun and interesting. And, who doesn't feel badass when you're pulling back a bow?
Like I
you know,
said, if you can do the bow and arrow and you can do the rifle, you're hired.
I've also thrown with an otlotto. So an otlotto is what,
What is it?
Paleolithic man used, an otlotto.
Oh,
And so it's a little implement that gives the human arm the force to throw like a 5 foot
mm,
long sphere 90 miles an hour. Just,
whoa.
and yeah, we invented that like when we
Okay.
were, chasing bison on the plains, right? With our
Oh
big
my
brains.
goodness. Yeah, you're
And so,
dropping some nuggets. I'm like, what is that? And if I hired you, can you use that also?
yeah. Yeah, I think I actually read there's only a few states where hunting with an otlotl is actually
Oh my
legal.
God. That is so funny. Well, thank you for that. That is so your exercise regimen now, is it all over the place? Do you do a lot of different things, or do you have certain things you really like to do the most?
Um, I've used Beachbody programs for 10 years. A friend of my
Mhm.
husband was like, "Oh, you would love P90X," and it was exactly how I had trained when I was in graduate school. Because at UT Houston, um, our gym was like right next to my lab, so I could set up an experiment. Go to the gym. I was really into just bodybuilding. I was actually very muscular at that time, and so I just love working out at home because, I had young kids and I was homeschooling. So, I'm always having some sort of weight training hit, in the mix. And my pandemic puppy went one way, and that caused me to fall down from my back deck onto the concrete below, onto my shoulder. So I spent, a good year and 5 months trying to rehab, my
Mhm.
shoulder. So I lost a lot of muscle mass
Mhm.
and a lot of strength and endurance. And so I'm focused on getting that back. So I just finished a fantastic program by Amola Caesar. He was an MBA trainer who did a program called 645 for
Mhm.
Beachbody.
Mhm.
And along with some rails and pails and cars that I learned in Rob Wolf's group um, with bases. I think it's New York bases now, has allowed me and a fantastic physical therapist to finally rehab this shoulder to
Mhm.
try and get my rope climbs back for my Spartan
Mhm.
races, my pull-ups, get my push-ups back.
Mhm.
Because I didn't have the confidence in the shoulder to do the push-up. I wasn't convinced that I couldn't do it. I think it was my mind not letting me do it. So
Mhm.
it's been a while trying to rehab
The
from that. So
mind. The
yes.
mind. Yeah, I constantly hear my patients talk about what their expectations are about their
Mhm.
body, and when I get patients who are starting, I would say even in the 50s, this is normal, because everybody in my family around 50 or 60 start having these problems.
Mhm.
Not just the metabolic diabetes stuff, just the aches and pains, just the lack
Mhm.
of mobility, but I know that, when I introduce you, you coach this ideal of aging well,
Mhm.
and I know a lot of people have a different perception of what that should be. I always comment that I feel younger in my 50s than I did in my 30s, right?
Mhm.
I don't have any autoimmune conditions, unless this irritable bowel is one. But 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 your thoughts on, this aging process and what it can and should be, and how people should think about it differently.
Mhm. Yeah, I think um, our lifespan has increased, and mostly it's a numbers game because our
Mhm.
infant mortality has decreased, but
Mhm.
our health span has not really
Mm.
increased. And I think in a lot of measures it's actually decreased,
Mhm.
where we're living a few years longer, but we're also spending a greater part of our time not living well with chronic
That's right.
disease, dementia, Alzheimer's. And they rob not only the person of their health, but all of their caregivers, and
Everybody.
their family members. And so, I started to just look at, mainly from trying to motivate people who necessarily, don't feel like they're unhealthy, that, this is the path that could be down the road for you. But hey, look at these people who are just living really well. And
Mm-hmm.
those people really do focus on their nutrition, quality movement,
Mm-hmm.
those primal movements, that we learned in, from Primal Health Coach Institute. So, it doesn't mean running marathons or doing,
Mm-hmm.
but just having a very functional body that's flexible and mobile,
Mm-hmm.
that, you know, people who age well, they really do pay attention to that. So they have the community, which is key, and, pretty much universal in all of the most long lived populations is that community, but also the movement and the mobility and the flexibility. And so it was really just trying to find stories to, motivate my clients to think about um, focusing on their health, like younger people in their 30s and 40s. Like, this is the time to work on those things.
Mm-hmm.
It's
That's right.
not when you go to the doctor and
Mm-hmm.
you get diagnosed with mild cognitive impairment, because you've actually had that. That's stage 3,
Mm-hmm.
right? You've been in stage 1 and 2 for, 15 years. And I think, that's where I was, where you're, losing your keys, forgetting where you parked your car, forgetting people's names, word recall, just, and all those things people tell you that you're just aging.
Yeah.
And I'm just like, no,
No.
I
No.
refuse to believe that. And because I know other people who didn't have that problem, right?
That's right.
So,
That's right.
as we talked about, part of me sharing my story, and you ask all these hard questions, really make me bare my soul, is just knowing that the path exists. Because if you don't know the path exists, you can't go down it. To
That's
know that, even with autoimmune disease, even with metabolic syndrome, you can get better. You
yeah.
can get well. It's not to say you're going to be cured. I can never go back to eating, a bunch of carbs. If I do that for days
Mm.
and days and I stop exercising, my blood
It's
sugar is like 115.
That's right. That's what's gonna
you
happen.
know, yeah, and
Yeah.
I got to just keep that liver,
Yeah. That's right.
depleted, um, because for whatever reason, was it not being breastfed, not having, I mean, I ate tons of dirt as a kid in the country, so it certainly wasn't that. And I had plenty of dogs and uh, dogs roaming around outside that I was exposed um, to that. But whatever confluence of genetics and birth history, and mom's birth history, which we know is important,
All of it.
and grandma, and and luckily, I think where I lived, I wasn't around so many communities of color or near plants and just environmental toxins and pollutions. I don't think I had any of those issues while I was growing up. That you can still work on these factors even when you're 40s and 50s,
Yeah.
so that you can, and I had my kids older, so I was like, I got to get these kids out the door so I can go travel with my husband.
Right. That's right. I love that. And I'm laughing at the dirt comment because my wife, who's from Mississippi, my mom, who's from Arkansas, they have history with eating dirt. So for all those who are not familiar, in the rural part of America, African American women and
Mm-hmm.
children, and I'm assuming the guys would eat dirt. And it was considered something they look forward to. And it still blows my mind, but that was part of that culture. So thank you for throwing a little
Make
culture in
mud
there.
pies and
Yeah. It's like, who does that, right? So that's amazing. And there's certainly a lot of minerals in dirt. So, but speaking of
mm-hmm.
eating, so many people of color hearing this message are the ones who really need to think about their dietary patterns, right?
Mm-hmm.
And we really want to make sure all people hear it, but particularly in those communities. And let's go back to New Orleans. I mean, let's be honest. They're not known for healthy food. They're known for delicious, tasty food. Can't say it's healthy. And I think
Mm-hmm.
about those foods I ate down there, the jambalaya, and being a low carb person, both of us, the rice that comes with that, and the
Mm-hmm.
gumbo, and the rice that comes with that, and of course the pecan pie, gotta have that, and then the highly refined grits, right? That
Mm-hmm.
goes with the shrimp and the grits dish,
Mm-hmm.
and crawfish
Mm-hmm.
etouffee, and so they had all these dishes that were very starchy. So as you've made your transition and you're trying to retain some of who you were and are, was it hard for you from a cultural perspective to eat less of those things? I know we can be creative. I know they have
Mm-hmm.
cauliflower rice, right? But so what? How did you manage that in a
Mm-hmm.
family with some Creole background?
Uh, it's difficult, especially less so from a low carb perspective,
Hmm.
because rice is probably one of the best things that I tolerate, besides like sweet potatoes, butternut squash. Um, but any, purified corn products, like, corn tortillas,
Hmm.
flour tortillas, which
Hmm.
is, the next morning my blood sugar is high for, 2 or 3 days. But rice actually seems to serve me very well. And
Mm.
from seeing a lot of people do carb testing, it's
Mhm.
true, for a lot of people. But I mean, that being said, I realized pretty quickly that rice and pasta were really just the vehicles for your main
Mhm.
dish.
Right, right.
So I don't have a problem eating stews, curries, gumbo without the
Mhm.
rice. I just use a spoon,
Mhm. Right.
you know.
Right.
Um, and I think if you can do that, or substitute, with cauliflower rice or something like that, but also really pay attention to the seed oils. Those dishes, can be very healthy. From an autoimmune perspective, all of those dishes contain nightshades.
Mm. Right.
And I'm very, I'm triggered by nightshades. And so, um, and I grew up, Mondays was red bean Mondays. And
Mhm.
I carried that with me. I love my beans. I love, black beans. And they really just do inflame, my GI system. And so I had to realize that some foods just don't serve me well and just can't really be a part of my diet, except for once or twice a year. And things like beignets. My last
Mhm.
trip to New
Oh,
Orleans, I
Lord.
didn't have a single beignet. So
Well, yeah, and that's hard. I mean,
it's
going to New Orleans without a beignet, that's,
that's like, yeah, that's
ooh-wee.
torture, man.
Yeah.
And so, and when I do go home and I come back, like I'm in a flare for a good 2, 3 weeks,
Mhm.
because I do indulge. Someone makes a good gumbo, I can't say no. But I know, the damage, that I'm doing. And recently, and I hadn't had that in the past, but my anti-gliadin antibodies came out very high.
Mhm.
So now it's all off the table,
Mm.
at this point.
Okay.
I have to be more focused on that and just, think about your ethnic background and think about your ancestral foods.
Mhm.
Like I heard someone say, "Oh, the low carb is a racist space because they're trying to take our foods, our
Yeah.
grits and our corn." And I'm like, "No, that's not our food, right?
Yeah.
Some of
Right.
those foods were the leftovers that we got, and
Right.
just getting that, like you said, the purified corn to make the grits, where you have to enrich it and put vitamins and minerals back into it because
Yeah.
everything's been stripped out. And so just think about what those ancestral foods are,
Mhm.
and the basis of the primal movement and the autoimmune paleo is really a return to those ancestral But
That's right. That's right. And I love it. So many nuggets. And I think the culture piece is important. And I really want to emphasize that we need to think about our bodies as individuals. We kind of look at our background, our ancestral component, kind of get a foundation there, go all the way back. You don't want to just start from, what was given to us. You want to go back a little further. And I think it's important that we individualize what's going to work for individuals because, as you have suggested, for you, rice works. Now, if I had everybody on a continuous glucose monitor, we could really identify a lot of information from that. So I think
mm-hmm,
people should listen to their body. If they have access to those types of tools, they should use them. And then if you find that your body can handle things that
mm-hmm,
maybe your neighbor can't, that's okay. And by the way,
mm-hmm,
you mentioned nightshades, and that's just I didn't know anything about nightshades until I started studying nutrition and functional medicine, but you just have some plants that are in a group that you think about: tomatoes, eggplants, potatoes, peppers, and things like
mm-hmm,
that. And they're just in this category that some people just don't tolerate. So,
mm-hmm,
so, so when you're doing like an elimination diet, you start saying, well, maybe I'll avoid the nightshades, or maybe I'll avoid those 8 like highly allergic things like, soy, dairy, nut seeds, or whatever,
mm-hmm,
eggs. So you start to think about ways to figure out what's wrong with you because again, your doctor may not be equipped to help you in that regard. So that experiment needs to come sometimes from the person who's going through it. And
mm-hmm,
so one of the things that is interesting. So many people in the South have been, disproportionately impacted by the chronic medical conditions. Of course, COVID has kind of brought that to light, as many
mm-hmm,
people have suggested. But they also, they also tend to be less active. They also tend to eat starchier foods because of what you just said. That's my culture. Don't play with my sweet potato pie.
yeah,
And but these things can increase their risk. It seems like there's a risk, and what we've read and seen in some recent studies that people of color may have an immune system that's a little over responsive,
mm-hmm,
and it sounds like you've seen some information out there that would suggest that in communities of color, our immune system is maybe a little different than
mm-hmm,
other immune systems. So what have you heard in
mm-hmm.
that space?
Yeah, that's something I've actually just returned to. When I was in graduate school, I had read a few papers looking at levels of certain cytokines like interleukin 2 and
Hmm.
TNF alpha. And African Americans definitely had just higher baseline levels of those cytokines, suggesting that our immune system is just a bit more active, a bit more on alert. And so I think, that might be, contributing to higher rates of hypertension and heart disease because all those processes probably at their core have an inflammatory process. And then you add, chronic societal stress
Hmm.
and, food insecurity and shelter insecurity, to the mix. And then those foods that we mentioned and not being as active, that it's a perfect storm
Hmm.
for all of these chronic metabolic diseases. And it was probably 8 years ago when my doctor sent me to a hematologist because I
Hmm.
just had some anomalous readings in my uh, cell blood counts and things. And so the doctor that I saw, I think she was transitioning from another specialty to hematology. And so she left her office with my lab work and went to the neighboring office with, the guy I think who's mentoring her. And they left both doors open. And I heard him say, is this the lab work for that black woman in there? And she was like, yes, it is. He goes, oh, well, most black people I see have low white blood cell counts. I
Hmm.
don't know what it means. And so you can't really determine anything.
Hmm.
And she came back, and it was the most difficult conversation. she ever had, because she was just very sheepish, like, oh,
Right.
I didn't realize, these norms really,
Right.
apply to, white people. And, we can't really determine based on this what
Mm.
you're, and
Mm-hmm.
I'm thinking, okay, aren't there enough of us that have had lab work that they,
They would be able
have
to.
separate, ranges? And, I know, you've probably seen, there's been a few reports right now about whether or not we should adjust that EGFR calculation,
Mm-hmm. Yeah.
because it disproportionately knocks African Americans out of kidney
Mm-hmm.
transplants,
Mm-hmm.
because based on that, this assumption that blacks have higher lean mass and higher
Mm-hmm.
creatinine that was
Mm-hmm.
made, I don't know how many, decades and decades ago, that they made this calculation adjustment and never really had data to
Mm.
show that it's accurate, that we
That.
have better kidney function at those numbers. And so in addition to these changes or differences in the immune system, and other blood components, I've been researching the fact that the triglyceride to HDL ratio, which I think may have come out of the Framingham study, that is a good indicator of cardiovascular
That's
disease
right.
risk.
That's right.
Well, the Framingham study was 99%
Oh yeah,
Caucasians,
no question.
right? And so now it looks like African Americans have heart disease with normal triglyceride levels.
Oh
So what does that ratio mean for us? And what does
yeah.
it mean for people like me or who biracial? You know,
Yeah. Who
like,
knows, right? Yeah. That's
so you
crazy.
think you have this great, number that's less than two, when in fact you do have, underlying heart disease, because, we have negative impacts at normal triglyceride
Mm-hmm.
levels.
Wow.
And so I think, while, a lot of time it's uncomfortable to talk about differences, we have to acknowledge that there are,
That's right.
physiological differences. And so, when you have someone, like, I mean, my readings are all over the place. Like, I had
Mm-hmm.
perfect CGM. My deviation was like 10, 80s, 90s. Yet my A1C was 6.1. The doctor's like,
That's
this makes no
insane.
sense.
That's insane.
Like, maybe blacks just glycate more readily at lower
Mm-hmm.
blood glucose levels,
Mm-hmm.
and then, my friend who's a nurse is like, no, they can't put you on metformin. You're going to be hypoglycemic all the time. Like, your A1C is meaningless. Like, you have the CGM data, what your body's doing.
That is
And
insane.
so I think, we need more people like you,
Yeah.
and we need more, um, people of color. And, the same thing goes for Hispanics.
Yeah.
You see the exact
That's
same
right.
thing in that
That's right.
community.
That's right.
And you also have the ethnic food issues with the tortillas and
Oh yeah.
tamales. And,
That's right.
you certainly see it in the Native American population,
Wow. Yeah, they
as
are.
for the
They have been.
diabetes.
They may have been hit
Hmm.
harder than any culture.
Anyone.
Yeah,
Hmm.
it's horrible.
And
So,
so I think it is this mismatch
mm,
of, diet, lifestyles, stressors,
yeah,
with our
yeah.
genetics.
And when the Indians were here, when they took away their their animals,
Bison and the
yeah,
orange
that was
game.
it. That was
That
it.
was it.
That was it
Yeah.
for them. That's all they had to
Hmm.
do. So,
Hmm.
if they went back to that diet, they probably wouldn't even see diabetes. So it's unfortunate, but
Hmm.
those are some nice perspectives. And just for those who are listening, uh, Dr. Cooper has agreed to join me on your health network. And we're going to talk about the immune system in terms of, what is it and what we can do to improve it. That'll hopefully in the next few weeks or so, you'll see that. So once it's available, I'll throw it in the show notes for for this episode of the Protecting Your Nest podcast. And we're on that platform because, again, as Dr. Cooper has suggested, we got to get the word out, and we have to do it. You got to, yell from the rooftops that there's another way,
Hmm.
So as we get towards the end here, I want to ask you a couple of quick questions. Are you an intermittent faster?
Yes. that has been really key
Mhm.
to healing, my
Okay.
insulin resistance. My fasting insulin now for the past 3 years fluctuates between 1.9 and
Mhm.
5. So I
Mhm.
think I'm good there.
Cool.
And I came out of that fitness world where you have to eat every 2 hours to stoke
Mhm.
your metabolism and
Mhm.
keep your, and it just was not,
Yeah,
serving me. And I found that once I went low carb, it could be 5 hours later and I haven't eaten.
I know.
I could go to my kid's soccer game and not bring all this food with me. I could get on an
Right.
airplane and go all the way to the West Coast and not bring, like, I'll bring
That's
some
right.
86% dark chocolate just in case I get some acid in my stomach I need to settle. But other than that, I can, you know, and I've done for 2 years, twice a year, every 6 months, I did a 5-day fast, water, salt, broth fast. And once you get past the first like 36 hours, it's actually really easy,
Yeah, I have found that to be true, and
to
it's not
do.
true for everybody, but for most
Hmm.
people, I take care of, once they get if they actually do, low carb, keto, or carnivore, they find that it's easy, and they have to I kinda eat a little bit on a schedule, and I
Hmm.
only eat twice a day because if I eat once a day, I just can't get enough in
Oh, yeah.
those I just can't
Hmm.
eat enough to make it
Yeah.
work, so I need a little bit more
Hmm.
protein, so
Hmm.
that's very interesting. The other thing that I wanted to throw at you real quick is this, primal health coaching concept. So, we know what coaching is, and, what's this primal part? What's that all
Hmm.
about?
Yeah, Mark Sisson, who's
Yes.
up there with Rob Wolf being one of the leaders in the primal space.
Mhm.
He wanted to multiply his message and just realize that people, while you can get the books and learn what you need to do, it's the implementing those behaviors
Yes.
that's the hard part. And
Oh,
he really felt that training coaches, in the primal philosophy, the nutrition, the sleep, the sunlight exposure, blue light exposure, stress management, meditation, primal movements, so,
mhm.
he, spent decades as a marathon runner, just eating all the high sugary gels, and it really contributed to that chronic inflammation that caused him a lot of pain and joint and muscle aches. And so just learning how best to fuel your body and stay mobile so that you can live well. That's really, Mark's message. And so I completed Primal Level 1, which is all of those things. And then Level 2 is really all about the behavior change.
Mhm.
And that qualified me to sit for the National Board of Health and Wellness Coaching, which they've been fighting the good fight to have health coaching
Mhm.
classified as a level 3 CPT code, so that we can really track how effective coaching is helping clients and patients, maintain behavior change,
Mhm.
get off their medications, so that hopefully in a few years it'll actually be a level 1 CPT code and covered by insurance. So they really needed to have a national standard that,
Mhm.
coaches are at this certain level. And so it really involves learning motivational interviewing and, just different aspects of just goal setting
Mhm.
and just really, meeting people where they're at and
That's
just
right.
figuring out how to motivate them and keep them on the path. And then additionally, I just received my autoimmune paleo certification
Cool.
through AIP certified. And I can give you their link to put in the show notes because
Okay.
I was part of their outreach to the Black and Indigenous people of color community because they're very passionate
Mhm.
about having more coaches um, in their ranks, to get the message out about
Mhm.
autoimmunity and how to heal your body, but as well as our unique perspective, in
Mhm.
dealing with these ethnic foods and just the pressures of society and the stress
Mhm.
that contributes to autoimmunity. And so they are actually taken applications for this next round of AIP certification. And so if you have any, BIPOC practitioners, doctors, they had pharmacists, that took the
Cool.
certification along with me, just learning, on how to help their patients better, then
Hmm.
they are welcome, to apply for scholarship.
Yep, and I think that that training is critical, and particularly as we are diving into a space that's still not quite mainstream, it's getting there.
Mm-hmm.
But
Mm-hmm.
while we're trying to, justify our perspective, it's important that we have, organizations that certify us, that train us, that fill the gaps so that where there's less variation in how we
Mm-hmm.
approach things. And I know I
Mm-hmm.
integrate motivational interviewing into my practice. In fact, one of the patients I saw today, I really felt like I was in therapy with her as a family doctor, just giving her some therapy and perspective. And I really feel when she walked out of that room, having lost a family member recently, and I just felt like when she left, she walked away better than she came. And so we have
Mm-hmm.
to have these skills, and we have to pause, and we have to stop being so focused on quality metrics, which are important.
Mm-hmm.
Things, and did you get your lipid panel? Did you see the eye doctor? Doc, I just lost my husband. So
Yes.
can we pause and talk about that? Is
Mm-hmm.
there some things you can share with me as a clinician that'll help me with that? That's what
Mm-hmm.
we have to be able to do. And we can maybe schedule another visit to talk about my lipids and
Mm-hmm.
and so I think that's so I think the skills that you're acquiring
Mm-hmm.
will better position you. And I love that. And so, but we need to make sure you're healthy. So as you think about the nest and the rope acronym, and the things that come with that, the nutrition, exercise, less stress, more sleep, recovering from trauma, thinking in a way that serves you, making sure your relationships serve you, making sure you protect yourself from organisms and pollutants that can harm you, and protecting your emotions and your life experiences. Where will Dr. Cooper put some focus over the next year?
Well, let's see. N for Nest Nutrition. So I'm about to start a protocol because my H. pylori is really high right now.
That's fair.
So, and I've had, and through my AIP certification, I learned. I think it was Angie Alt told me she had two clients that when they weaned off methotrexate, some of these other food sensitivities ramped up because now you don't have the brakes on that immune system.
Mhm,
And, as happens to everyone, it happens to coaches. I was feeling so good. You start to loosen the reins.
mhm,
You start incorporating some of those inflammatory foods like once. And so, I found myself in this pickle of having a lot of GI distress that when I went carnivore, I had, completely solved all those issues because I had suffered from a really severe IBS C. So that's IBS with
mhm,
constipation for years. And so, probably further impacting my hormone status because then your estrogen's high and your progesterone's way too low. But and so now I have to go back and kind of plug those holes. So it's going to be going back to my AIP roots and
mhm,
not indulging in the Thai foods because the
mhm,
nightshades and the spices and then once I feel like I've healed myself, go back to the reintroduction and see, okay, what can I tolerate
mhm,
again
mhm,
in this absence of having methotrexate? Because
mhm,
that really did give me, this buffer.
mhm,
And so that's for nutrition. Um, E for exercise. Just getting my strength back, getting my muscle mass back, climbing my ropes. My happy place is trail running, and so I'm hoping in the spring that I can incorporate my Weisla because they're runners, but she runs a lot faster than I can. So I have to really train her to, to keep my pace. And so I would love just to be out on the trails with her
Yeah.
now that she's 2. And so that's
Yeah.
my exercise. Sleep always has to be on the front
Yeah.
burner. Like she's been sick and having to go out, during the night. My college kids are home. They're roaming the house. And I already feel like my brain is just starting to things are getting slow. So get them back off to college and start focusing on my sleep. And then T was for, how you think. That one I had to really think about. And it's more, for me, I think I can't do all the things,
Yes.
And so,
Yes.
right now I just started, I'm a first year student at the School of Applied Functional Medicine.
There
And
you
I'm
go.
trying to do that's like, a master's PhD level nutrition, biochemistry, metabolic health, thyroid, immunology. And, I really need 20, 30 hours a week to study. And so you can't also do like all the other things
That's
because
right.
then, my stress goes up, my flares start to go up. And so really it's just trying to pay attention to getting up in the morning and having the sunlight on my eyeballs.
Yeah.
That's the primal way. It's like as soon as you get up,
That's right.
you get that serotonin activated, right? And that's going to become your melatonin later in the day. And so, what was the next one?
It's the rope relationships. Yes.
Relationships.
Yes.
That one, I think, in 2022, I would really like to go and visit some friends. Like, at least where I can just drive to Boston and hang out with some friends. I would like to go to the Metabolic Health Summit, and just see all the people that I'm talking to
Yeah.
online,
That's right.
like you, for instance,
That's right.
in person. And, really, I mean, my 2 kids are in college. I have one in high school. So, it's, opportunity to spend more time with my husband, basically, because,
Right.
I'm not hyper, focused on the kids, but, hopefully as the world, sort of, normalizes to start having more, face
Yeah.
to face
Yeah.
contact.
Got to do it. We're not getting enough of that, and I will be likely. It's not official yet, but more than likely with KetoCon. They have something in July, I think. So I'll probably be one of their.
Where is that one?
I think it's in Texas.
Is it Texas? Okay.
I think it's in Texas. It's so funny because my father-in-law who I sing country music with, because he's an old trucker, and one of our songs is "All My Exes Live in Texas."
Texas.
So I'm always thinking about Texas. I sing that with him every other day or so. So yeah, so it's all good. And then, of course, avoiding organisms and pollutants that's COVID all day long, right?
Yeah, that's that's COVID, getting my, H. pylori down, as well as, like I garden without gloves, just being exposed to those types of, organisms is important too.
Yeah.
For, just training our immune system. Hey, don't react to those things.
That's right.
Pollutants, yeah, I don't know. Probably the only thing I pollute myself with is like a little bit of bourbon every once in a while.
Yeah. Yes, alcohol is a toxin, but we're not going to go there.
Yeah.
But in moderation, right?
Yeah.
Just do all the other stuff really well.
Yeah, all the other stuff, and then life experience is definitely not enough. Of those.
We got some catching up to do. Yeah. This last couple of years has kind of messed that up. But this is a life experience. I mean,
yes, it is.
Doing this work in the podcast realm, meeting you and interacting with other people, those are life experience I'll always cherish. I have a lot more friends than I had a couple of years ago. it's,
Oh,
it's
yes.
yeah, it's just
Mm-hmm.
growing. So I'm really
It is.
enjoying this life
Mm-hmm.
experience. So I think that's
Mm-hmm.
awesome. So I like what you're saying. I like what you've shared today. And I really think somebody who's going to hear this will be inspired to take a leap.
Mm-hmm.
I did one of the things on Your Health Network, which was started by Charles Maddox, who wrote the reverse documentaries for diabetes. I interviewed Dr. Akita Evans, and she and I reviewed the Big Leap book. And I think I'll release that the week of our recording and release. And you just gotta, people who are listening, it's time to leap. It's time to
Mm-hmm.
jump. It's time to, we can't keep waiting. And
Mm-hmm.
your leap towards finding a solution has led to you being able to do some of the things that you've always felt you should and could do. And so I
Mm-hmm.
really am happy that you did your leap. So as we kind of wrap up, people are going to want to find you, maybe do a consultation, get some coaching. So how can they do that?
Mm-hmm. They can go to my website, sybilcooper.com,
Okay.
or, hit me in the DMs and Instagram,
Okay, cool.
um, or Facebook. But all of my social links are there on my website, which,
Cool.
I've been doing all the other things instead of that. But, I hope to start doing, just more writing
Yeah.
at that site, and kind of, consolidate all my thoughts around the
Mm-hmm.
differences, that,
Mm-hmm.
the triglyceride, HDL, the EGF, just start, providing that information to the community, and hopefully we can, change some minds, get
That's right.
some, studies. I know Angie out with the AIP, folks are now, along with, Dr. Walls, actually have the clinical trials to show that autoimmune paleo works,
Mm-hmm.
to help, lessen, and for a lot of people, put autoimmune disease into remission, so that people can just live their best life. And
Mm-hmm.
it can feel really isolating, especially when your family members and your friends don't understand, and they think you're doing this, strange restrictive diet.
Mm-hmm.
Um, but then when you start telling them all the wonderful things that you eat all the time, like,
Oh,
scallops and, steak and chicken and, um, shrimp and all the different, dishes and
yeah.
stews, um,
There's
it
no
doesn't
there's
feel
no
restrictive.
suffering. No, it's no
Yeah.
suffering.
Yeah.
And even
Mm-hmm.
when I ate gumbo the last time, I had cauliflower rice, and then the time before that, I just didn't have any rice. I just ate gumbo, but it was still
Mm-hmm.
delicious. The
It
the
was
rice
still
didn't take,
delicious.
all that other stuff was pretty good, so it didn't really take
Mm-hmm.
away. If anything, it's not
Mm-hmm.
the rice that makes it taste good at all. It's
No, it's
yeah,
not.
yeah. So I think there's
Exactly.
ways you can navigate. So
Mm-hmm.
thanks for bringing a little New Orleans to the show today. I appreciate you. Looking forward to our conversation about the immune system. And I hope our relationship continues to grow as we share this healing message. So thanks again for being with us
Yeah.
today.
As do I. Yeah. Thank you so much for letting me, share it, and hopefully we can change some lives.
Absolutely. And that's what we're going to do. And for those
Mm-hmm.
who are watching or listening, Dr. Cooper has provided additional evidence that maybe, just maybe, a diagnosis of chronic autoimmune conditions does not equal a life of suffering. With the right lifestyle interventions, you may find you can put these conditions into remission and restore the active life we all hope to have, allowing us all to
Mm-hmm.
age gracefully, which is what I want to
Yes.
do, and Dr. Cooper wants to do. Yes, yes, yes. Dr. Cooper and I both believe that everyone hearing our voices have the potential to not only hear this message of healing, but use that knowledge to make the necessary changes to heal. So as we celebrate 2022's first episode of the
Yes.
Protecting Your Nest podcast, I encourage each and every one of you to use this year wisely and spend a little time each and every day walking towards the healing you deserve. That decision
Mm-hmm.
to heal will not only positively impact your life, but the lives of each and every one who knows you. So
Hmm.
again, I look forward to sharing my next episode with you. Doc, I thank you again for being with me today.
You're welcome.
And until we meet again, be safe, be well, and continue to protect your nest.